This is Healthcare Now, radio's trending now. Get ready for an exhilarating 30-minute ride through the latest topics driving change in digital health across the news and social media. Join us as our subject matter host takes the lead in uncovering what's hot and what's not. So buckle up and tune in to stay in the know.
Welcome to Trending Now on Healthcare Now Radio, where we explore the forefront of healthcare innovations and transformations. I'm your host, Shahid Shah. Today, we're really excited to have Rachel Weissberg, Healthcare Provider Strategy Lead at Neteera. What's trending now and what Rachel and I will discuss are innovative healthcare solutions and the future of healthcare technology from a writ large perspective, but really, we're going to dive deep into how Neteera is transforming patient care through cutting-edge technologies, especially contactless health monitoring. It's for years, I've worked with nurses, I've worked with doctors who basically do data capture work for a lot of their day, right? Capturing a vital sign, figuring out what some numbers might need to be entered into an EHR. And what's really cool about the work that Neteera is doing and what Rachel is going to talk to us about is where is the vision of where healthcare is headed in terms of really being able to use AI, telemedicine, patient-centric care when we have contactless health monitoring fully integrated into that capacity. So really excited to get started. And Rachel, you've been in the healthcare industry for a while. I think you started when you were 3 years old, but that's why you have some experience here. But Neteera is doing some really cool stuff. So let's start with that question first is, to give us a little background of yourself, and then tell us what's the unique stuff that Neteera is working on that everyone should know about.
So my background, like you said, I was 3 years old and I started working in healthcare. No, my father's a radiologist, so I've been in and around healthcare my entire life. I gravitated over into the healthcare technology space and have been there for 25 years. I came to Neteera about a year ago because I was really excited. I think one of the biggest challenges that we all see is just this influx of patients and the ratio of patients to caregivers. And we really need to do better and have information about our patients so that we can provide better care. With Neteera, it's exciting. We have the ability to do touchless vitals, so contactless vitals monitoring. And really what we're trying to do is augment some of those clinical workflows and help give time back to the caregivers so they can spend more time at the bedside and have that intelligence right from the start, have it before they get into the room, know about what's going on.
Yeah. So tell us a little bit, what does that contactless mean? And if you walk into a normal hospital where they don't use Neteera, and then you walk into a hospital where they do use it, what's the difference?
Well, the difference is you would either be wearing the technology, you would be wired to the technology, you would be tethered to the bed, you would be carrying something with you. With Neteera, it's on a wall above the ceiling, and there is no touch, there's no wires. Where we're finding a lot of traction today is in non-telemetry units. So where we understand we have those telemetry units where we're driving all of that intelligence, but there's a lot of blind spots in hospitals today. And so by having technology like Neteera in the room, you're able to collect insights without anyone being there. So that's where we are today, is really in those, like I said, non-telemetry areas of the hospital, the emergency department, labor and delivery, things like that.
Yeah, so often we kind of like bundle all of this into remote patient monitoring for remote evaluations, et cetera, but it can go more than that, right? So what would you say that Neteera is doing more than just remote patient monitoring?
So some of the other things that we do outside of patient monitoring is actually bedside activity, right? So we can take heart rate, we can take respiration, but we can also see how the patient's moving in the bed. If they're in bed, if they're out of bed, how long they've been out of bed, the frequency they've been out of bed. And some of those behavioral characteristics are really interesting when you look at, right now we're doing a lot in addiction centers, right? So as people are coming off of drugs and they're withdrawing, we see the respiration and we see bed movement, and we know all of that around, have they had sleep? Have they not had sleep? It's not just the vital signs that become so critical to the care, but it's also just the activity of the patient and how they're moving.
Yeah, and that's really what excited me as you guys told us about what Neteera is doing, and I've been interviewed for on other journals where we talk about what does the world of contactless monitoring, et cetera, bring us to. One of the things that I'm often hearing is, well, this disrupts what we do today. Mm-hmm. So that really is a really important topic. So when we hear that word disruption, we almost always think about it as negative. Why is this disruption a positive thing? And is it really disruption or is it something else?
Well, I'm just a constant disruptor. I've been that since I was born. My parents tell me that. But I think the reality today in healthcare is that providers who are resisting innovation today might find themselves obsolete tomorrow. And our technology isn't just about enhancing the current workflows, it's about preparing the health system for the future, where efficiency, precision, and personalization are all non-negotiable.
Yeah. So as you think about that being non-negotiable, if we bring this technology in based on the customers you're already working with, where have you found mostly objections long-term, or have they been short-term objections? They're like, wow, this is going to really hurt me. And then, a few days later, they find out, oh my goodness, this is really, really good. What are some of the things that people often challenge you with? And then once they start using it, those challenges generally go away.
I think the biggest objection is there's no way that can work. And I don't even know if that's really an objection. It's contactless. How is that even possible? And I think once the device is in, and it's almost like you set it and forget it. So once it's there, all of a sudden you have access to all this data and all this intelligence without physically being present in the room. And we're seeing things with early deterioration. We're seeing things before they happen. So now it's become this, don't take this away, because I'm going to have to go back to putting more time and doing it the way I was doing it before, which I don't want to do it that way anymore.
So if we think about how hospitals are often sold digital health, and you and I have done this for many years, where we go in and we tell them, we've got this really innovative solution. All you have to do is install our software, and then it will give you all of these benefits and improved outcomes and lots of innovation, et cetera. But there's something special about what Neteera is doing today, which is quite different. And that is truly innovative in the sense that it's not the same as before. And there are really net new things that you'd be able to do if you did this, quote, small disruption, which is move to contactless. And it's not really truly disruptive in the sense of changing and making you do more work. It's actually less work with a higher amount of outcomes. So how does Neteera see itself setting itself apart from other just normal digital health type of companies that are doing software only?
So I think Neteera is really at the forefront from shifting from reactive to proactive healthcare. And our technology is designed to identify issues before they escalate. So this is enabling our providers to intervene earlier and really reduce the need for more invasive, costly treatments down the line.
So when you look at these costly treatments down the line, do you have some just general examples? Like what I can think about is if you have a home health scenario, a health at home scenario, just one simple nurse not having to go to a house is a cost savings, right? That's one example. How should customers think about other examples that they could just install this, set it and forget it, and see huge benefits?
So I think it's not only the nurse having to go to the house, but it's also the patient not having to go to the emergency room, right? So if you're able to see something and catch it early, maybe you notify the doctor, this is happening. It could be as simple as something's going on with a medication. You're able to do all of that within the home. And now one is, as a patient, how convenient for me. I don't have to get up. I don't have to go to the hospital. I don't have to move myself to do those things. But also the hospital doesn't have to carry that burden of an additional admission or having someone come in, right?
Yeah. And so it sounds like you could even seems like it's weird, but you could actually go to marketing and sales teams who are building service lines, and you can actually make contactless remote monitoring type of functionality a cornerstone of your sales process to say, use our healthcare services because you won't have to come and use our healthcare services because our physicians can see what's going on at your house even before you do. And of course, there are service lines that occur inside hospitals that can also be improved. Is that how Neteera is trying to help people who are building new service lines built around this idea of heavy digital capabilities?
That is exactly what we're doing. I think there's a couple prongs with our approach. One is working directly with the provider and the health system itself, obviously working with some of these long-term care facilities. But the other really strong focus for us is the physicians. And as they're building out those service lines and they're thinking about how do I better manage my population, my patients, this is one of the things that they can add into their current workflow and being able to see patients where they are, all of their patients, and know what's happening in real time.
Yeah, I think that's great advice because as you look at when we normally build technologies, we often go to the IT department or we often go to med techs, et cetera. But it sounds like if you do a proper set of technologies like what Neteera is doing with contactless remote patient monitoring, you can actually give healthcare providers and their service line professionals something that they could offer in a marketing and sales capacity to say, here's why we're unique. Come to our facilities because we have these capabilities.
100%. And that's what we're seeing with these physician groups and other post-acute facilities. They want the patients to come there. This is setting them apart. And it's giving not only the patient, but the families more comfort that they know that they're getting good care.
Yeah, what might be cool is, as branding improves for these kinds of products, you would basically be able to see a patient or a family member say, I'm not going to your facility because you're not using a device like there or something.
That is a conversation we have every day. How do we get to that?
Nice. So other promises that companies are making these days are AI, telemedicine, patient-centric care, et cetera. Now, they're often discussed in very, very broad terms, but let's dive a little bit deeper. We often hear, when we hear AI, we hear people considering ethical needs, et cetera. How does Neteera position itself to navigate these kind of challenges with potential pitfalls of AI, ethical concerns? Is it truly set and forget, and then nobody has to worry about it? Or are there things that you do have to adjust a bit?
So I think one of the biggest pitfalls is forgetting the human element. While technology can automate many processes, it's essential to maintain empathy and personal connection in patient care. So Neteera's solutions are designed to enhance, not replace the human touch in healthcare, meaning we set that. So even though we have this device hanging and providing you the data on your patient, the doctor needs to interpret that, or the nurse still needs to interpret it. We're not removing that away. And this is just designed to give you better intelligence so that you can get to something before it happens. We need to be more proactive and less reactive in the care we provide.
Yeah, I love it. And in fact, that's one of the things we're hearing more and more is the more you add AI, the more you put in technology, the more important the human element is, which sounds kind of weird, right? However, we know the tech is fantastic, and the providers and patients, really, they are determining its success, not the technical companies. So how does Neteera ensure that the innovations are truly user-centric, not just in terms of patient outcomes, but really the experience that patients are getting? How are you working towards that?
So our technology is really built to reduce the administrative burden on the healthcare providers. It's about freeing up time and giving more time back for direct patient care. By streamlining workflows and even automating some of those routine tasks, will help providers focus on what they do best, which is caring for the patient. We need to get back to caring for our patients.
Yeah, and so the way that I've seen people using Neteera pretty well is that as the technology gets introduced, as it gets installed and people get accustomed to it, it almost kind of disappears into the background. People are just handling, talking to patients, right? Spending time with the patient. They don't realize that, a week ago when they didn't have these technologies, that you would have really been, you had a piece of, you had a vital sign monitor, you had something that you were doing directly on the patient. So I think that's really, really important for us to recognize is if you put in the right technology, it should disappear.
Right.
If you put in the right technology, it should be giving you more time with that hand holding, that touch that we were lacking in the past. I think that's what you're saying.
Yeah, thank you. You did a great job.
Awesome. So if you're just tuning in, you're listening to Healthcare Now Radio. This is Trending Now. I'm Shahid Shah, your host, and I'm talking to Rachel Weissberg at Neteera. We're discussing how Neteera's innovative solutions, especially around the idea of contactless health monitoring, this remote patient monitoring, the ability to sense what's going on in the room, in the bed, without having to have humans turn something on or measure something, just ambiently measuring things that are going on and how that helps with improved patient outcomes. So as we continue, we know that you guys are going to be presenting at the health event, HLTH, in a little while. I believe it's in October, if I'm not mistaken. So Neteera is going to be featured at booth 11 at the Israeli Pavilion. If people are looking at stopping by, what can they expect to see there in person? That is more than just a typical sales pitch. Of course, you need to do the sales pitch. But what's the wow factor that you'd be able to talk about and show at the event?
I think people will be really impressed when they come by and they see how the technology works. So we won't just be talking about what we can do. We'll show what we can do. We can provide some real life demonstrations of our technology in action and really show how we're transforming patient care.
Yeah, and so let's go back a little bit to that transforming a patient care. Tell us a little bit about what has AI done in the last few years that if, let's say, generative AI or the modern AI tooling had not appeared, is there anything that would look very different at Neteera, meaning you guys were already on the path and now the modern AI tooling has assisted in that? Or are you doing something unique with AI that your customers should know about?
So one of the things that we're working toward with the AI, the more devices we have out there, the more data, the more we learn, right? And we're taking, in a 72-hour period, over 300,000 data points on a patient. With that data, what we want to try to do is map the physiological changes with some of the other things that are happening, right? So can we, with a camera, and see things? It's not our camera, but it will be another organization's camera, right? But what we can see this is happening, but how do we marry that with what is physiologically happening so that we can have some predictives? And I think that's what you'll see in the future. The more as we grab this data and we see this data, you'll continue to see us say, hey, we now know if these set of circumstances, because the heart rate's up and this is down, and when they're on their side, we know that that's an indication of some kind of clinical problem. That's what we're trying to get to.
Yeah, that sounds fascinating. And so as you think about that piece, one of the challenges most companies have is how do you get this integrated not only into the human workflows, which is very difficult, but what about the integration into EHRs, into other systems of record that might then do other things with it for claims, billing, utilization, et cetera? How does that world look?
The beauty of our platform is it's open, right? And so I'm a believer, I've been in the space for a while, is no one wants another window, no one wants another tool. How do we integrate it in the tools that we have today? So if we're using the EMR as our source of truth, we're going to move into that source of truth. Our system, our technology is designed to integrate there. The other piece is in nurse call and how we communicate to the nurses without the alarms and the alerts. We're not changing the way the user interacts with the technology. We're just adding and enhancing that to them. So adding a layer of our own intelligence into that current workflow.
Yeah. And so when you look at what Neteera is producing in terms of the vitals, how much of what a normal physical exam is done today does that capture? Is it 10%, 50%, 75%? And give some examples that our listeners can think about and talk about with their colleagues.
So I think we're, from a vital signs perspective, or we have the 2 vital signs, we're working on a third. That would be probably about 70% of what you need to know about the patient will come through our device from a vital perspective. An example of where we've been very successful, like I mentioned, detox and withdrawal. We're able to see that change in respiration, so the deterioration in the respiration. And an example was the nurse checked on the patient before they went to bed, closed the door, and probably would not have come back until the next day. And during the night, they crashed. They had their respiration crash significantly. So an alarm went off. The nurse went in to check. They sent that patient to the emergency room, and they found out they had acute onset encephalitis, which left untreated, I don't know if the patient would have been there the next day. So that's an example of where our technology is making an impact.
So in those cases, then it sounds like this would also be almost perfect for remote type of clinical trials or things where people are trying to study the outcome of a procedure that they're doing research on. So where, if any, place do you see Neteera's usage in research and clinical trials?
From a research standpoint, right now, we're really focused on sepsis. I think everyone's focused on sepsis. And can we have some information of heart rate, respiration, blood pressure, all of the different types of vitals that we would need to know somebody's becoming septic? Working with different customers right now. And we don't have, I want to be clear, we haven't figured that out yet, but we believe we can. And that working with different partners and healthcare communities, we can come up with some algorithms that would help predict those things in the future.
Yeah, one thing I would make it almost like a call to action to our audience here is there is so much cool stuff you can do once you have contactless remote patient monitoring, contactless capture of data. There's physiologic streaming, and we're talking about gigabytes and gigabytes of data being captured on a regular basis. This is almost gold for researchers. So if you are sitting inside a hospital, or you're sitting inside a pharma company, and you say, well, as soon as I give a drug, to Shahid in my clinical trial, and I give a different drug to Rachel in the same clinical trial, how does Shahid, as a male from southern India, respond versus Rachel, which is a female from Northeast United States, respond? And in the old days, what you would have to do is you'd have to create surveys, and you'd have to put those surveys in front of all the patients, et cetera. And to me, it seems like even with all the huge benefits on the hospital side and the home health and the health at home, seems like researchers should be, beating down a path to your door saying, look, as soon as I give a drug or I want to try an operation, new procedure, et cetera, I need to know what happens over the next 4, 8, 12, 72 hours. And you can't really do that without a technology or solution like contactless remote patient monitoring. So just think about think about the next 4 or 5 years as you look towards the future. What are some cool things you can do? And knowing that you are a FDA cleared, regulated device, there are not promises you can make. There are no things you can say like do this and all of a sudden you'll be cured. And by the way, that's a very important note for everybody listening in to make is you will not hear Rachel going outside the bounds of saying what we know that the devices can do, because they are a clear device and they can get into a lot of trouble. So that's not true of most software and hardware that we've worked with in the past, but it is true here. So think about the future, and just let's think about what would be the art of the possible in research, if you got some examples.
You were sending me down a research path.
Yeah.
I just wrote, I need to add this to our overall strategy. So in all honesty, I mean, we've been really focused around the hospital, the home, and post-acute settings, and even thinking through senior living. But I love where you're headed in research. And I think that it's a very interesting space. And my feeling would be, I'd want to talk to others. And what are you looking at? What are you researching? But because the truth is, the less interaction we have from the patient, right, in that process, or even the caregiver, the quicker we can get the information that we need, right? The quicker we get the study, the more we can learn.
That's right. No, I love it. And in fact, as you think about the other parts of this, if you think about utilization, reimbursement, other areas, have any customers asked you about how they could install these kinds of tools to help them inform to do better claims, better utilization review, more and useful information going to payers? Have people looked towards that direction yet?
So the place is really in the remote patient monitoring, right? So as we look at remote therapeutic monitoring, remote patient monitoring, there's definitely a reimbursement model that is available to that. And I think that that's part of one of the things that we've been working on. And it's going back to some of the physician groups, right? Is how do we process the claims? How do we take this data, utilize this as a session? So there's the ability to offset some of those costs for the device, because now you have you're monitoring the patient, you have the visit, and you have that claim capable.
Totally agree. And I think let's double click on that a bit, because today we're doing better than we were during the pandemic, where everybody had a -2% or -3% margin. Today, we're just at maybe 0.5% margin, 1%, 2%. But whenever new technology is introduced, it rarely has a way to immediately pay for itself.
Right.
This is one of those where you want to spend a little time, speaking with Rachel and others. So if you're a customer thinking about contactless tools like remote patient monitoring, there are existing reimbursement codes, which are now many years old. So it's not like the first time you'll be doing this. And if the issue is not around disruption of workflow or how do you improve workflow, but your CFO says this is not affordable, that may be something. So talk about, if somebody came to you and said, this is not affordable, what would you tell them, Rachel, about how you could get reimbursed for it?
Well, I have to be really careful what I say here. I think the reality is there are ways to capture revenue when we treat patients and wherever we treat patients. And so really understanding the care model of the hospital or the physician group and how they're working today, having a conversation around that and seeing where the opportunity is to offset some of those costs because it is a patient visit and therefore a patient visit is billable.
Yeah. And so as you think about the patient visit, there's three other places that I've seen this kind of technology actually play a really cool role. And you've heard me talk about utilization a bit, which is when you are utilizing these kinds of tools, you know the work that was done. And so the patient visit can actually be upcoded in a completely ethical way to say, here's all the work that our physicians did, because here's what the vital signs showed that they did. That's one area. The second area is, of course, just cleaning up the claim codes to give more accurate codes. And then the final thing is a truly new service line could be possible with remote patient monitoring as a fully reimbursable activity. And so say you were spending $500,000 this year on a bunch of tooling, not just for Neteera, but any other kinds of tooling. And if you could build those around the remote patient monitoring and the related claims code, there's a lot of ways of getting that money back over time. And so it won't be all within 1 year, but certainly over time in general, without, you can't say everything to be immediately positive or not, but there are ways of getting this technology to be paid for by itself with what it will bring back to you in real reimbursements over a few year period.
I think the other thing that we're seeing is you're seeing this centralization of care at health systems, these virtual command centers. And not only are they looking to centralize telemetry, patient flow, even virtual care, but it's all about that continuum of care and following the patient through the whole life cycle of their journey. One of the things to think about is we as a health system want to be able to, I don't want to say control that care, but best manage that care to make sure that patient is getting the right care along their journey. In partnering with some of these post-acute facilities, like even the long-term care, you can take that into your centralized command center and now monitor all those patients that are in long-term care, have a better gauge of, nope, we're not sending that patient back, right? And really controlling, again, I use that word control, but doing a better job at maybe managing the workflow of those patients. And that's another way to capture the revenue. So you could share in that with those long-term care facilities that you have partnerships with and ultimately do a better job at ensuring the care for the patient and they're getting the right care at the right time at the right place.
No, I love it. That's a great way to end here. And Rachel, so thank you so much for your insightful perspectives here. To our listeners, thank you for joining us on Trending Now on Healthcare Now Radio. Stay tuned for more episodes where we explore the latest trends and innovations shaping healthcare's future.
This is Greg Masters for Healthcare Now Radio. The Neteera 130H and 130H Plus vital sign monitoring sensor is an FDA 510K Class 2 medical device cleared for spot and continuous measurement of heart rate, respiration rate, and behavioral features in adult patients within healthcare facilities and home use. The indications provided are to be used by healthcare professionals and are intended to be reviewed by clinicians to inform on patient care. The Neteera monitoring system is not intended to be used as an alarm system for potentially life-threatening situations in which medical intervention is necessary. This live radio segment or on-demand replay may include discussion on future device features. For further details on its current applications, please visit www.neteera.com